Offices with nearly 200 offices across the United States. It is my absolute pleasure to now hand over to Dr. Goldberg to take us through the study.
Thank you so much, Katie. You just made me feel very old. So here we go. So I've been doing this for a very long time, and it's rare that I get presented with technology that I think is as novel as the T2 here is from Artemis. So we're going to talk about why I think it's important to have technology like this, what's going on in the market. We'll talk about the actual device itself, show you some before and afters, and take questions at the end. So what is our agenda? First, I'm going to talk about the skin laxity epidemic. We'll talk about a study that was done actually in Italy, and we'll go through it. We'll show some before and afters, and then talk T-shape 2 really by the numbers. So the skin laxity epidemic, I think everybody knows this. This so-called Ozempic face and body. It just blows my mind the number of people now who are coming in either with volume loss on their face or on their thighs, even sometimes on their buttock. They're losing weight, but they're also learning to realize what the consequences of that are. So I've been quoted from the podium, numerous meetings. We're now experiencing the GLP-1 effect in aesthetics. The patient demand for treatments to deal with the skin-related issues has surged. We all know the numbers that are out there is that people using GLP-1 agonists, they're probably not real because those numbers are based on pharmacies and have nothing to do with compounded GLP-1 agonists. And who knows how many people are going to be on these drugs over the next 5 years. But the people coming in with the effect of the GLP-1 agonist on their body is now becoming an integral part of my practice in aesthetic dermatology. So the skin laxity epidemic, we know the role of these weight loss drugs. We're seeing it really in every age group. The baby boomers, which would be my group, Gen X, the millennials, Gen Z, each showing up a little differently with different issues. Obviously, the younger patients in some ways are more concerned about the effect on their body than some of the baby boomers are, but they're all showing up. And you can see some sense of what this weight loss drug scale looks like. It didn't really exist, and now all of a sudden it's gone through the roof, and it's projected to be exponentially larger as we go through the next few years. The weight loss drug market, forget about the aesthetic technology we use to treat the consequences of it, but the weight loss drug market in the U.S. Itself is expected to reach $51 billion in the year 2030, so 5 years from now, which is up from just $2.4 billion just a mere 3 years ago. So you see where this is going, and that's probably good for a lot of people, but ultimately it's going to be good for us because we treat the consequences of that. A little bit because, as Katie mentioned, I am with Schweiger Dermatology. We are 10-state practice, almost 200 offices from coast to coast, but it's a dermatology office. And so the emphasis really is on, yes, we do some aesthetics, but a lot of medical dermatology. And you wouldn't think this sort of bureaucratic type office would be selling these drugs, but we are. Because GLP-1 drugs are part of the general practice, it's part of aesthetic dermatology, it's part of medical dermatology, it's showing up in the med spas, it's showing up everywhere. And a survey conducted by the American Society for Dermatologic Surgery, the top concern among 35 consumers that were interacted with was excess fat on any part of the body. And now we're dealing not only with excess fat, but the loss of that fat. And according to the American Society for Plastic Surgery statistics just last year, 41% of those prescribed these GLP-1 medications or agonists for weight loss are now considering non-surgical procedures. And yes, some of them are going to need surgery, but the overwhelming majority can be treated with technology we have today. So this clinical study was done in Italy. Had a chance to really look at the paper and the way the study was performed. It's an excellent study. It relates to this technology, which is called T-shape 2. That's the name of it. Artemis is the company. It's an advanced multifunctional system that is redefining face and body contouring. And the reason it's doing that, it's taking things that we've had for years, but we're all on separate devices, and putting everything together so that we actually hit the skin with multiple different energy delivery systems. So it's an FDA-cleared Class 2 device. That means it can be used by estheticians. Class 3 devices are typically lasers. As I said, it is multifunctional on the face and the body, and it combines 4 advanced technologies: bipolar radiofrequency, low-level laser light therapy, endodermic vacuum suction, and mesospheric therapeutic activation. And because of all 4 of these not being used separately, but being used together, we get a completely non-invasive treatment, which is effective and has virtually no downtime.